Hi, I'm Dr. Vissio at Briar Animal Hospital, and our clients often have questions about how they can care for their senior cats. So we've written down some of these questions, and my assistant Jet will read them off. Here we go.
Dr. Vissio, what are some things I can do to make my aging cat more comfortable?
Let's see. So I would say making sure they have a nice, safe place to rest. Sometimes that may be a covered area, other times it may be a place up high. But a nice, comfortable place with cushion for their elbows and joints as they become a little bit more achy or bony, making sure that they don't get pressure sores. If they like to sit on hardwood floor or other areas, trying to create a little pad like a yoga mat or something could be helpful. And then also making sure that the litter box isn't difficult for them to get in and out of. Sometimes you might have accidents outside the litter box just because their arthritis does make it difficult for them to get up into it. So maybe having a shorter entryway for them to get in, and making sure that those areas are accessible so that they have choice. That's really one of the best things in welfare, is making sure they have freedom of choice so that they're not on opposite ends of the house. If they're having more difficulty walking around, then you have those areas closer together, and that they're in an area of the house that's separated from the busiest hub, the activity, so that they can remove themselves from that activity if they choose.
How do I know if my senior cat's in pain?
So cats will display pain in many different ways. It's not always obvious, but I would say that, licking an area, limping, they may not cry out in pain, especially chronic pain or pain that develops slowly, like arthritis, and can get worse. It can be very painful, but they have gotten used to it. It's not something that they need to deal with, and we have many ways that we can help reduce that pain. But you might notice that they lick an area, they pay attention to it. They might not use a leg. If they're jumping down off a couch, they might notice that they land with one more than the other. Or if they jump up onto things, they're kind of jumping more with one leg than another. If they're not able to get into the litter box, they're going outside the litter box, you may not notice any limp, but they're just choosing not to do that because they know that that causes them more pain. Choosing different areas to be in the house and what they normally used to do. You may notice that they become a little bit more grumbly or growly or ornery, more vocal, while other cats, it seems, may actually seek your attention and may become much more friendly if they had always been very standoffish. So those behavior changes can sometimes indicate pain. But physical exam and actually palpating the areas of the body usually is the best way to tell. So those are some things.
Does my senior cat need to be vaccinated?
We strongly recommend keeping your pets vaccinated, or at least making sure that their antibodies are at levels that are protective. Because again, age is not a disease, but as we age, we are more likely to have disease. So making sure that we're not susceptible to those severe life-threatening diseases. Those can come in bodily fluids on your clothes or anything else. You can transfer those to your pets even if they're indoor-only cats. So we do vaccinate senior cats. We use vaccines that are the safest. That technology is always changing, and we try to stay up to date with that, so we're not using things that overly stimulate the immune system just to get enough protection. We also do offer vaccine titers. So if your pet has been regularly vaccinated, every few years throughout its life, every pet is different. We can't guarantee that your pet is protected if they've had many vaccines, because every immune system is different. But we now have been checking a lot of titers, and majority of the time cats are protected, but other times their levels have fallen below the necessary protective levels for antibody titers, and we do need to revaccinate. But yes, I feel like that's an important thing to keep your pet healthy.
How do I know if my senior cat has a good quality of life?
Good quality of life is something we talk about the most. So that's really knowing your cat, knowing what behaviors they do on a daily basis that seem like their personality. If they like sitting by the window watching the birds and they stop doing that, that's something to pay attention to. If they like going on their little cat tree or roaming about the house, making sure that they're doing those things. Oftentimes cats can be more active in the evening, so you may see them resting a lot, but making sure that they're resting comfortably in their areas, that they're interactive with you. Cats that I feel like start to have a poor quality of life, they start to retreat, they become less interactive, they hide. Those are some of the main things, but I feel like it really is, it depends on every cat, so that's really a conversation that we have that's individually tailored to your pet.
Why does my senior cat sometimes yowl at night?
So yowling could be personality, to be honest, but it can be an indication of other things as well. So you could have something like cognitive dysfunction, they're a bit confused at night, their vision might not be the same. Some disease processes like hyperthyroidism, other things will have increased vocalization as a symptom. So it's always important for us to evaluate them and then decide what's normal or not. All right, as always, please let us know if you have any questions. We're just a phone call away, email or text. Let us know if you need anything.